So hello and welcome to the Encephalitis Podcast. We are here almost 2 months on to reflect on the 10-year anniversary of World Encephalitis Day with some of the amazing people who make it possible for us to deliver our campaign on the incredible global scale that it achieves year on year. Today, I'm joined by 3 of our visionary campaign partners who come from some of the companies that support our work. These companies are Valneva, Quest Diagnostics and UCB, a mix of pharmaceutical and diagnostic companies. So welcome to all 3 of you. We're absolutely thrilled to not only share our highlights video from World Encephalitis Day with you, but we also want to hear about your engagement with the campaign and our work. So I think it'd probably be really helpful if we start, firstly, by asking you to introduce yourselves to our listeners and to say a little bit about your organisation and why it has an interest in encephalitis. So Judith, I'm going to start with you.
Thank you very much. So I'm Judith Perez Gomez. I am a PhD pharmacist of 20 years in industry, several specializations in vaccines. I joined Valneva, so that was 2 years ago as the VP of Medical Affairs. And I would say that above all, I'm very passionate about vaccines and public health. So Valneva, we're a biotech, a small company. We're focused on development and the manufacturing of prophylactic vaccines for infectious disease with unmet medical need. And our vision was really bringing this contribution to make sure that nobody was suffering from vaccine-preventable diseases. So with that said, the collaboration with the Encephalitis Society was really a natural fit for us. We clearly see the importance of raising awareness, of supporting those who are affected with encephalitis, and particularly with infectious encephalitis. And we are very proud to have the Encephalitis Society as one of our key charitable partners.
Thanks, Judith. Danielle, let's stick with the pharmaceutical world for a moment and turn to you.
Sure, Danielle Hartigh, and I am the Global Patient Engagement Lead for autoimmune encephalitis with UCB. And in our rare disease organization, I'm located in Atlanta, Georgia. And a little bit about UCB, we're a medium-sized pharmaceutical company, probably best known for our work in neurology and the epilepsy world, as well as Parkinson's and a few others. But we're really beginning this journey in rare disease, and our goal of working with communities with significant high unmet need, which we believe autoimmune encephalitis is that community, and we hope to be a great partner and play a role and hopefully improve the standard of care for these patients.
Thanks, Danielle. And Michael.
Yeah, hi, my name's Michael Racke, and I'm the Medical Director for Neurology at Quest Diagnostics. Quest Diagnostics is actually the largest diagnostic company in the world, and we have a large focus on neuroimmunology, and particularly in encephalitis. And one of the things that I saw in your video, and we made a video highlighting the importance of people, particularly primary care physicians, identifying these patients. Often these patients have different types of diagnoses. And it's really, I think, what I learned a lot from World Encephalitis Day is how much we need to get out and raise awareness so that these patients are diagnosed earlier and treated earlier.
Thanks, Michael. Well, Michael raises that very important point, actually. And I think we'll start with you again, Judith. If you can give a brief summary of how Valneva got involved with World Encephalitis Day and what activities took place in your organisation.
Yes, yeah, thank you. Well, for that, I have to deep dive on my old colleagues who were in Valneva before I arrived. So if I'm right, we started probably back in 2016, early 2017. So what they told me is that, first of all, well, because we do have a Japanese encephalitis vaccine, when they showed the patient testimony, they were really very impacted because, I mean, this is, I mean, you know what you want to prevent, but when you see it, it's really very impactful. And then I think we understood very early the importance of supporting the organization and how the organization was helping the patients, but in a very guided way, having a real impact in the patient's life. And I remember when I joined it, they told me, Judith, you really have to meet the Encephalitis Society colleagues. So they're really making a lot.
Oh, that's amazing. Thank you. Danielle, let's hear a little bit about UCB's involvement and activities for World Encephalitis Day.
Sure. So, we believe that obviously within the entire encephalitis community, awareness and education is very important, but that really we can't do anything with or for the community as colleagues of UCB until we really understand the journey of these patients. So, one of the things that we did to kick off World Encephalitis Day was to have an internal learning session. We invited everyone from our rare disease organization. Ava helped us by creating a video to really introduce for everyone in our organization, especially those that don't normally interact with patients, to understand what autoimmune encephalitis is and how it impacts patients and the needs of the community. So that was highly attended, but then we decided to share it out a little bit further. So we shared it on our intranet. And asked all employees to not only watch Ava's video, learn a little bit more, but share on social media. So we got about 1,200 internal folks at UCB to engage with that. We also participated in the Shine the Light event and lit up both of our headquarters in Brussels and Atlanta, as well as a few other, the King and Queen Towers in Atlanta. So some big landmarks. Just to feel like we helped participate as well as sharing on social media. So it was a drop in the bucket compared to the global campaign, but we really felt like we were part of the community.
Thanks, Danielle. I think it's important that lots of drops in buckets make the campaign what it is. Michael, tell us a little bit about Quest's activities and Yeah,
so we actually first got involved, I believe, in 2020 when the meeting was still in person in Dallas. And, with our involvement in neuroimmunology, I think that it was a natural fit to support the Encephalitis Society and World Encephalitis Day. I actually first participated virtually, I guess, in 2021. One of the things that we were very involved with and presented on was the role of COVID and how there certainly were many case reports of encephalitis autoimmune encephalitis post-COVID. The thing I should say about this most recent, and I don't know if you can see, I'm wearing my World Encephalitis Day t-shirt, which happened to occur during our national sales meeting. So everybody from Neurology at Quest was wearing these red t-shirts. And certainly I think it gained a lot of vision within the company that we're involved in supporting the Encephalitis Society and World Encephalitis Day.
Thank you, Michael. Well, each year, as you all know, we try to condense all of the many highlights of World Encephalitis Day into one short highlights video that encapsulates for us what the day is all about, particularly for our members, our beneficiaries, the people who support us, and of course the global healthcare community. So I'm going to give you an exclusive screening of the video and then ask for your thoughts, get your reactions, and hear maybe a little bit more about any things that were particular highlights for you. So I'm just going to share my screen.
With the awareness that's going on as part of World Encephalitis Day, this is brilliant for those who may have had the condition and maybe are recovering from, to get an understanding and appreciation of what they're going through.
Together we're stronger, and together we can make a difference.
Today is World Encephalitis Day, the 22nd of February, our 10th anniversary. We've got famous landmarks and iconic buildings lighting up around the world red for World Encephalitis Day to raise awareness. Things like Niagara Falls, the Jet d'Eau in Geneva, the Dancing House in Prague.
17 locations around Perth will light up red this evening for World Encephalitis Day. It's amazing. The BT Tower has the World Encephalitis Day on it. Big red symbols everywhere you look. It's up on Piccadilly billboards. So many people pointing to the billboards, everyone's stopping and looking, and I think it will really help awareness of encephalitis going forwards.
New research has revealed that survivors of encephalitis have thought about or have attempted suicide. All this research has been put out to mark World Encephalitis Day. To tell us more, I'm joined now by Dr Easton, CEO of Encephalitis Society.
Ordinary everyday infections that people will be familiar with, such as the cold sore virus, measles, or of course more recently COVID-19. Or it can be caused by a person's own immune system going wrong and attacking the brain in error.
Today on World Encephalitis Day, we wear red for WED.
I happen to be in Montreal, Canada. I have goosebumps all over me. This is so special of an event. As a survivor, I'm glad to be part of it.
I am calling on you to do some research and learn more about encephalitis today and help me raise awareness by sharing this video.
Join us in supporting the Encephalitis Society.
Wear red.
Wear red.
Wear red.
Wear red.
Wear red. Wear red.
Wear red.
Wear red for World Encephalitis Day.
Red for WED.
Yes! I want to say thank you to all of the buildings that have gone red for World Encephalitis Day. I want to say thank you to all of my team at the Encephalitis Society. And I want to thank our encephalitis family. Incredibly privileged. World Encephalitis Day, 22nd of February, 2023. Amazing.
So obviously I've seen that a few times, but I'm keen to get your reaction. Danielle, we'll start with you. Any thoughts?
I was blown away by the global reach of this campaign and seeing so many different nationalities, people living with their families, everyone that supports them involved. But I love the fact that you release some important data on mental health and the things that are important to the community, but blown away by the global reach and some of those world landmarks. Impressive.
We were thrilled. So we went from a reach of 58 million in 2022 to, as you saw, 111 million in 2023. So this is a campaign that's really gaining some traction. Michael, did you have any thoughts?
No, I mean, I had similar thoughts. You know, one of the things that I think is important is it definitely is a worldwide issue. One of the things that I failed, I guess, to mention before, but that is important was we had Maddie Bomey come out to talk to our people. And one of the things is she was in a small rural area. And I think that was part of the reason that she was mischaracterized and misdiagnosed for a long time. And, you know, we don't necessarily think about the fact that we have to really look everywhere, right? That people can get exposed to a virus in very unusual places. And the fact that this campaign is worldwide is because it's a worldwide problem.
Thanks, Michael. Judith, any thoughts?
Yes, I mean, I'm always amazed to see that year after year, I mean, it's like a growing energy. It's not going down. It's just like every year a little bit more. So having all these people being involved, working together from different nationalities, families, different ages, I think is really amazing.
Thank you. Well, I want to spend a couple of minutes talking about the importance of the day for you and for your teams. I know the excitement that it brings to our staff team and the encephalitis community, our beneficiaries, our volunteers and so on. But I'm keen to hear what it means to your organisations and why it's important for your organisation to take part in events like these, because I think sometimes people think of, you know, the pharmaceutical industry and diagnostic industries, they're these huge organisations, and actually I don't think people realise that you do get involved at deeply at a patient level, which I think is really important. So let's just spend a couple of minutes on what it means for you and your teams, and what difference being involved in campaigns like this can mean for the people in your organisations as well. Michael, I'll start with you.
So, I think I mentioned we actually brought Maddie Bomey in to actually tell her story to the sales team. And I think, it's one thing to go out and say, we're selling this testing that's important to be able to treat people, but it's another thing to actually put a person's face to the diagnosis. And the other thing, we were involved also in making a video where we had somebody with autoimmune encephalitis, meningoencephalitis, and viral encephalitis. And I think the other thing that's important to point out is that these presentations are quite different. One of the patients pointed out that they were going to be referred to a psychiatric hospital. And very often when you start having like behavioral changes, people don't necessarily think that it's a brain infection. They think that it's, or an immune response in the brain. They think that it's something else. And I think that's one of the key things in terms of raising awareness and helping get these people treated, because even in the video you saw people that as they said, they had survived encephalitis, and I think the one person I think had a little bit of you could tell some slurred speech. These people, when they recover, it's not always that they recover 100%, and getting the accurate diagnosis right away is very important in trying to get a complete recovery.
Absolutely. Judith, what does getting involved with World Encephalitis Day and these kind of patient campaigns mean for the people in Valneva?
Well, Valneva is a quite small company when we think about it, and every single affiliate did something together or individually. So that was great. So that showed that it was important for everyone. So even if it was a small piece of contribution, everybody was willing to take that moment. And in my particular case, I sit in Lyon, where we have the offices, and they're quite new. And since the pandemic, that was the first time everybody was into the office. So we brought everyone together with the teachers for a picture. But everybody came. So we're still in some telework, but everybody was there the day of the picture. At the end, you see one picture, but there was a lot of energy behind, a lot of love, a lot of commitment. So yeah, that brought a lot of energy for everyone.
Oh, that's amazing. Danielle, UCB.
It's opportunities like this, they're rare, to bring the community into UCB. And we hope anything that we do, we're a few years pre-launch, so we're in the clinical phase, but everything we do, we want it to be meaningful. We want it to be driven by patients living with this condition. And this is an opportunity to bring the community in. There's a lot of people in our organization who aren't on the front lines. They're working in labs or they're working in manufacturing. And for them to feel that they're part of the community, they can see the impact with the community. It's a true motivation and an inspiration for them. So it works both ways for us. And I think it brings a lot and drives a lot for our motivation and what we do every day.
Yeah, I think there's a fantastic synergy. I think you're right. But Danielle, sticking with you for a moment, beyond World Encephalitis Day, I'm going to ask each of you, how your companies are helping support the encephalitis community outside of, this global campaign. What else are you doing?
Sure. Being in the clinical trial phase, we're in a little bit of a different position, but this is a crucial time for us in the development phase to make sure that everything we do, everything we build, everything we think about is with the patient community, not just what they might considering or thinking what they might want, but asking them and bringing them into the journey with us. So, I mean, I think this is the really critical phase with the community, is understanding the needs, how we can meet specific needs within the community, but also where we may help fulfill and serve to help raise awareness, not only help increase diagnosis rates, but where can we help serve the community? So bringing them in really to everything that we do.
And Judith, what's Valneva doing in the world of encephalitis?
Yes, for us, probably as we're a company focused in prevention, so in prophylaxis, we take a lot of attention to work around the disease awareness, of course, specifically about the mosquito-borne, like Japanese encephalitis, working with healthcare professionals. We're also working on trying to help individuals to understand the potential risk, to also work with the medical staff, and also on the benefits of the information of encephalitis, and also how to make sure that we feel empowered to then share this knowledge with their patients.
All really important work. Michael, what's happening in Quest Diagnostics in relation to encephalitis?
So, obviously we've been very involved in both diagnosing viral encephalitis as well as autoimmune encephalitis. But I think where the research is going, and I think where we hope to be, is that as molecular diagnostics becomes more rapid, one should be able, for example, to look at spinal fluid and immediately say whether is it just human DNA present, is there viral DNA present, and then what should be the next step after that. And the other thing, obviously being a diagnostics company, it's important to try to help the physicians make the diagnosis sooner. So one of the things, as an example, all our panels have been basically directed at adults. And so now we're making a pediatric encephalitis panel so that when pediatricians are seeing a child and where they're concerned about whether they have encephalitis, that we're specifically targeting disorders that would affect children as opposed to adults.
It's incredible. I mean, it's just incredible to hear such fantastic work going on in all of your companies. Not wanting to put any of you on the spot, but looking forward to 2024 World Encephalitis Day number 11. And also it will be, I don't know if you know this, but it will be our 30th birthday in 2024 as well. So we're super excited. Have you got any plans or ideas bubbling away for how you are going to be working with us in 2024, either for our birthday or for World Encephalitis Day, or is it all under wraps for the time being? Michael, I'll start with you.
I was going to say the Encephalitis Society doesn't look a day over 29. So, but we hope to again be supporting the Encephalitis Society, and I think that we'll see what we can do in terms of promoting turning buildings red on Encephalitis Day.
Fantastic, Judith.
Yes, we are already starting to plan. So usually we're a little bit late, but this year we are really trying to anticipate. So we know for sure that we want to focus at least on how to make sure that we support the recognition of symptoms and the impact of the disease. But we also have the teams trying to think more innovative ideas. We can't promise anything, but we would love to see Leon red, for example, or try to go more in that direction.
It feels like you could launch like some kind of internal competitions in your organizations for ideas for World Encephalitis Day and see have some kind of competition among your teams. But Danielle, what do you think might be happening with UCB?
I love the idea of an internal competition, an idea generation, a little idea factory. But I think, building upon the learning and education for our internal colleagues and then how we can support out. We'd like to do more with patients and bringing them in to the organization next year and really helping us understand every aspect of what they live with. And then do a little bit more on the social front as well and be a little bit more prepared this year for the social sharing. So that's probably the biggest agenda items. But I think given the idea factory and a little competition, you never know what we could generate.
Exciting. And I know, Danielle, I'm seeing you in Boston, I think later this week, aren't I? So we can chat further then as well.
Yes.
I will open this up to the three of you to just shout out, but I'll finish as I always do on these podcasts by asking any of you if there's anything that you would have liked me to have asked you that I didn't, or if there's anything that you want to add before I close up the podcast.
Well, I mean, I think, and we probably share the same feeling. I think we would like to thank you, that's for sure, and everyone, all the team behind on the Encephalitis Society for the fantastic work you're doing. We know there's a lot of people behind. I have the opportunity to meet them. So, yeah.
Thank you.
Judith, I would second that and say, seeing the video and the amount of worldwide coordination that goes into the work you do, I can't think of anyone to do it better. So thank you for all you do for the community, and we're just happy to partner in any way possible.
Thank you.
Yeah, no, I would say was very impressive to see how the response really has become worldwide. And we certainly, as a company that focuses mostly in the United States, but does begin to have somewhat of a reach outside of the United States, I think it's important to realize that these are disorders that do have spread across the world, and very often, hearing about something like the Japanese encephalitis. But one of the patients in the video that we produced was a businesswoman who had traveled outside the country, and that's how she got exposed to encephalitis. And when she came back to the United States, and I think that was part of the problem, was that it was an infection that the American physicians were just not familiar with. And I think that's something that, again, with the worldwide outreach, it's important to get this kind of these diseases well recognized so that we can treat these people as early as possible.
Absolutely. Well, we couldn't do any of it without the support of people like you and organizations like yours. So we just want to say, a massive thank you on behalf of all the patients. World Encephalitis Day undoubtedly each year will contribute not insignificantly to saving lives and doing what we know is important, which is that early diagnosis. And with early diagnosis comes early treatment. And of course, the gold standard, which is preventing this condition if we can through vaccine, as we know. So we want to say, thank you to all of you and your amazing organisations for making World Encephalitis Day the success that it is. We certainly couldn't do it without you. I will finish, as I always do, by thanking all of our listeners to the Encephalitis podcast. So many people have helped us to reach this point, and we continue to be amazed at the impact and growth of this global campaign. I want to take the opportunity to thank all of the people at the Encephalitis Society, all of our beneficiaries, everybody that gets involved in encephalitis, World Encephalitis Day, because we couldn't do it without all of us doing a little bit towards it. So thank you. Here's to World Encephalitis Day 2024. For our listeners, don't forget that the Encephalitis Society remains at your service. So if you need any support or information wherever you are in the world, our teams are there for you. Go to encephalitis.info for contact details or to chat online. We hope that you've enjoyed this podcast. And as always, if you can support our life-saving work, we would be extremely grateful. You can do that by visiting encephalitis.info/donate. But here's to the next World Encephalitis Day 2024. Thank you, everybody.